Thank you everybody for being here. Thank you and welcome to our Blindness and Glaucoma webinar. My name is Alexandra Luzier. I am the Vice President of Business Development and Communications with Accessible Pharmacy Services. We are so excited to have everybody here with us today, and especially to have these two incredible presenters with us, Elena Sturman and Dr. Shukla, with us today to be speaking about all things regarding glaucoma in the blind and low vision world. First, I want to give a huge thank you to everybody for attending, and I also want to give a huge thank you to the Glaucoma Foundation, as well as to Columbia University's Irving Medical Center for putting this on with us today. We had 1,000 people register, and we're so excited for the turnout. So thank you for coming and spending your Friday afternoon or morning with us, depending upon where you are. For those of you who are joining us for the first time, we are Accessible Pharmacy Services. We're a home delivery pharmacy. We specialize in individuals who have a disability, and we are the only provider of its kind. We are the largest blind-owned healthcare company in the country. We have done a few of these webinars before on various healthcare topics, ranging from eye drops to diabetes to breast cancer. They have all been recorded, and they are all available on our website if you are interested in checking those out. Our website is accessiblepharmacy.com. Throughout this webinar, Melissa will be here to supply us with ASL interpretation. So thank you, Melissa. And this webinar is also has live closed captioning. After the webinar is over in the next few days, we will be sending out a follow-up email. So that follow-up email will have a few things. It will have links to the video and audio recordings of the webinar, as well as the transcript. It's also going to have resources from the webinar from our presenters, as well as a chance for you to respond with feedback, which we really encourage and appreciate. Before we get started, I just want to run through some quick announcements. Like I said before, we do a few of these webinars throughout the year. We have set dates for our next two webinars for 2023. On Friday, September 29th, we will be having a webinar surrounding mental health. On Friday, October 13th, we are going to have one discussing clinical trials for the blind community. Both webinars will feature experts from various organizations relating to those topics, and we'll have registrations open very soon for each of those webinars. Like I said before, all of our previous webinars were recorded and are available in video, audio, and transcript form on our website, accessiblepharmacy.com. One of the ones we did last year was in collaboration with the Chicago Lighthouse's optometrist, Dr. Kelly Scherer, as well as their occupational therapist, Laura Hayes. They're phenomenal. And it was all about eye drops. Simply put, they talked about tips and techniques to administer eye drops safely and effectively. It was super informative. It was great. So if you're interested in learning more about that webinar, please go check it out on our website. Or if you just have questions about eye drops in general, we would love to discuss all of it with you. Our phone number is 888-633-7007. I also wanted to let everyone know that the Glaucoma Foundation has an upcoming webinar this Tuesday, June 20th, also surrounding eye drops, specifically minimizing adverse reactions from eye drops. They have a stellar lineup of individuals speaking, and it looks fantastic. So please, if you are interested in attending that event, please visit their website for that registration. We also just launched our information for this year's Blind Health Expo 2023. We were absolutely overwhelmed with the positive response that we got from last year's expo, which was the first time that we put on that event. We had no idea what to expect. And I just want to say thank you to everybody who attended and participated. And if you exhibited, thank you as well. The Blind Health Expo is a completely virtual event. It's an online expo of healthcare information, products, services, and medication for individuals who are blind, who are living in the low vision community, as well as any disability community. So this year will be a 2-day event running on both Friday, December 1st and Saturday, December 2nd. Last year, we had 120 exhibitors and thousands of attendees. So we are super excited to put on the event this year with everyone's feedback from last year and make it even bigger and better. We already opened attendee registration. It is free to attend. We would love for you all to check it out. And that registration link is open and available on our website, accessiblepharmacy.com. More information on being an exhibitor will be available in the next few weeks. So when that comes out in the next few weeks, please check it out if you are interested. But yes, that is the Blind Health Expo, free to attend, free to exhibit, taking place virtually on Friday, December 1st and Saturday, December 2nd. My last few announcements are really, really quick. We are expanding our services to support patients in other languages. We're really excited about this. It's a natural parallel to what we currently do in the communities we currently service, and we will have more information on that coming soon. We are also in the process of launching an incredibly robust and complex diabetes initiative for individuals living with diabetes as well as living with low vision. I will have more information on that also very soon, probably in the next few months. And lastly, we are working to expand our work and outreach in the deaf communities as well. We will also have more updates on that in the next few months. I'm just super, super excited about all of it, and I can't wait to share everything with all of you. Now, to get to the webinar itself, it is my absolute pleasure to introduce our first speaker for today. As I mentioned before, we are doing this webinar in collaboration with the Glaucoma Foundation. We are so thankful to have Elena Sturman with us to speak today. We've been friends with Elena for a while now, and we have participated in a few of her webinars. So we are super honored to have her here with us to speak about all of the wonderful things that she does. She is the president and the CEO of the Glaucoma Foundation. Elena is amazing, and she has over 20 years of experience in fundraising and executive management, and it gives me great pleasure to introduce her to speak about the Glaucoma Foundation's background and all of their patient support services as well. So please, without further ado, Elena, please take it away.
Thank you so much, Alexander, and thank you to Accessible Pharmacy, to Andy, and to Alexander for inviting me. I'm delighted to be here with all of you. Let me share my slides. Let me try it again. Can you see my slides? Is it a full screen? Perfect. Thank you very much. So my first slide shows the logo of the Glaucoma Foundation and our tagline, our vision, your sight. And today I'd like to tell you a little bit about who we are and what we do. So this slide shows all of our board of directors. The Glaucoma Foundation was founded in 1984 when glaucoma was widely misdiagnosed and grossly misunderstood. We have come a long way since then, raising awareness about glaucoma, bringing more scientists, clinicians, and researchers to work in the field, and creating many patient programs. To date, Glaucoma Foundation consists of 20 volunteers who serve on the board. There are scientists and clinicians, business and finance directors, psychologists, communications leaders, glaucoma patients, and philanthropists. At the head of the foundation are 3 world-renowned glaucoma specialists. The first photo is of our chairman, Dr. Gregory H. Harmon. The second photo is the founder of the foundation, world-renowned glaucoma specialist, Dr. Robert Rich. He is also a co-chair of the Scientific Advisory Board. And the third photo is of Dr. Louis Pasquale, who is co-chair of the Scientific Advisory Board as well. My next slide shows photos of our Scientific Advisory Board members. Our Scientific Advisory Board comprises of 37 experts from around the globe who work on the problem of glaucoma and who help us identify and fund the most promising research in glaucoma. This slide shows the rendering of human head and the connection of optic nerve from the eye to the brain. And in the last 39 years, the Glaucoma Foundation has funded many, many millions in basic and applied research. Last year was our banner year when it comes to fundraising. We have committed over $1 million in research funds that consists of our regular grant funds, our named grants, and our larger grants for 2 years. This slide shows a photo of a think tank in progress. Our annual international think tank is a meeting that brings experts from different fields from across the country and around the globe to share their insights and to chart the course for future research. Over the years, these meetings have been incredibly successful, bringing many collaborations and getting path to many discoveries. This slide shows an anatomy of a human eye and has 2 words, education and outreach. And that's what Glaucoma Foundation does. We provide education and outreach for patients and physicians. This slide shows a screenshot from the Glaucoma Foundation's website. The Glaucoma Foundation's website, www.glaucomafoundation.org, has wealth of information, anything from the eye and its structure to latest research, to diagnosis and treatment of glaucoma, and to, very importantly, patient center, where patients can find a specialist, including a low vision therapist. This slide shows images of the publications that Glaucoma Foundation produces. Our bi-monthly newsletter goes to 16,000 households electronically, and it's also available on our website, together with our latest research and our patient guide, Doctor, I Have a Question. Both the newsletter and patient guide are also available in print for those who do not use internet or emails. This slide shows a woman talking to 2 attentive listeners, and it says on top, tell your story. And that's what the Glaucoma Foundation does. We encourage our patients to share their stories with our readership. Patients provide insight to one another, how to successfully live with glaucoma, and how to manage self-care. And for physicians, understanding patients' experience is the key step in providing patient-centric care. This slide shows men typing on the laptop, and it also shows photo of Dr. Aakriti Shukla. And we provide support for our patients through our online support group that calls APOP, and it stands for Adult Patients Under Pressure. Patients can connect with each other. They can share their hopes and frustrations, share the latest medications and procedures. And whenever there is a medical question, Dr. Shukla moderates the group. And Dr. Shukla is a member of Glaucoma Foundation's Medical Advisory Board. This slide shows man watching his laptop, watching a video on a laptop and taking notes. Glaucoma Foundation provides monthly webinars to our constituents. And in the last couple of years, we have covered a myriad of topics. Anything from what do cold hands have to do with glaucoma? And the slide shows the poster from that webinar, to the body-eye relationship. And the slide shows the webinar from the poster from that webinar. And the discussion between a patient and therapist of how to preserve your mental and emotional health while having glaucoma. And the slide shows a poster from that webinar. The next slide shows a poster from recent medical education webinar. A group of people listen attentively, and all of the sponsors. For the first time in history of the Glaucoma Foundation, last year we held a medical education symposium for both optometrists and ophthalmologists, where both groups were in audience and presenters. It was a very successful webinar. We were able to grant 220 CE/CME credits and had close to 300 people in attendance, both virtually and in person. My next slide shows a young teenager in headphones looking at his laptop, and it also shows a poster from a new initiative that calls Start with the Young. This past January, the Glaucoma Foundation brought a brand new initiative called Start with the Young in partnership with STEM Institute of CCNY. It was geared towards middle school and high school students from underserved neighborhoods who are mostly Latinos and Blacks. The goal of this new program was to teach these youngsters about what glaucoma is, what dangers it presents, and how important it is to get a comprehensive eye exam. We hope that they will bring this message to their families, their loved ones, their parents and their grandparents. And we plan to continue this info session every year. This info session was run by Dr. Jose Quiros. Dr. Quiros is one of our minority glaucoma fellows, a program we run with Research to Prevent Blindness. And on this slide, you see 7 of 9 fellows that we've granted over the years. We also administer a Career Advancement Award in Glaucoma Research with Research to Prevent Blindness. And this slide shows the latest awardee, Dr. Matthew Van Hook from University of Nebraska. This slide shows a woman and different icons for social media platforms. And TGF is on all of them. We are on Twitter, TikTok, Instagram, and Facebook. That's the way we connect with our patients. And we are even on TikTok. And this slide shows the TikTok icon and our TikTok ambassador, Jacori Doppel-Hall. Jacori is a glaucoma patient, an artist, an educator, and a very, very talented young man. He creates a series of TikToks for us about glaucoma, what it is and what it isn't, his personal experience, and how to find trusted sources. If you are on TikTok, please follow us. If your children on TikTok, please tell them to follow us. This slide shows a poster on a bus shelter that says she doesn't know it yet, but she's going blind. And it was part of our glaucoma awareness campaign last January for Glaucoma Awareness Month. We had a lot of posters like that. We also had billboards, and we had public service announcements on a local radio. This slide shows an image of a white-haired man. It shows image of eye care home tonometer, and it says your IOP rises and falls throughout the day and night. How can you monitor its highs and lows? Glaucoma Foundation has many partners. One of the partners is a company called My Eyes. My Eyes provides eye care home tonometer to patients for a short period of time with the prescription from their physician. What we learned during our partnership is that patients who need the eye care the most more often cannot afford it. So the Glaucoma Foundation was able to secure a grant and provide eye care to patients who are financially disadvantaged rent-free. And to date, we've supported 35 patients, and many of them report that knowing when their IOP spikes has changed the course of the treatment. This slide shows posters from various events. I am very fortunate to travel around the country to talk about patient issues and meet with organizations whose mission is in line with ours. This slide shows 3 pictures lying upside down on a couch, and it says sibling survey. It also shows a pie chart of the other survey. And the Glaucoma Foundation is very fortunate to provide surveys for our constituents that gather the data that helps researchers and big pharma to find the best way to allocate their resources and also the best way to advance patient care. This slide shows a platinum seal of transparency from Candid and 4-star charity navigator and a woman looking ahead. The Glaucoma Foundation relies on contributions from corporations, foundations, and many generous individuals to fulfill our mission. We are very grateful for their support and their confidence in our work. For our work, we've been awarded the highest grades from 2 most trusted evaluators of nonprofits, Candid and Charity Navigator. This slide shows a close-up of an artist's brush working on a painting, and it says Visions for Visions. And in August, we will launch our 4th annual TGF's Art Challenge to celebrate vision. It's a fully digital peer-to-peer challenge fundraiser where amateur and professional artists could share their digital copies of art. We place it on our website, and each artist has his or her sub-page. When you go on the website, you can see artist bio and artist photo, but we pixelate the art, and art only comes into focus when the fundraising threshold is met. And last year, we were able to raise $85,000 through this challenge to support research. And we hope that those of you who are on this webinar will be interested, will go on our website and will participate. And my last slide again has the TGF logo, and I'm very grateful for allowing you to listen to me and to present today. And thank you for your attention. And now it is my great pleasure to introduce the next speaker, Dr. Aakriti Shukla. Dr. Aakriti Shukla is a board-certified ophthalmologist, fellow-trained glaucoma and cataract surgeon, and is the Leonard Lauder Assistant Professor of Ophthalmology at Columbia University Medical Center. Dr. Shukla published over 60 peer-reviewed articles, and her research interests include structure-function relationships in glaucoma, optimization of surgical outcomes, and sustainability in ophthalmology. She serves on Ophthalmology Glaucoma Editorial Board, AAO Sustainability Task Force, the World Glaucoma Association Associate Advisory Board, AGS Glaucoma Screening Task Force, the ASCRS Young Eye Surgeon Clinical Committee, and the Glaucoma Foundation Medical Advisory Board. Ladies and gentlemen, please welcome Dr. Aakriti Shukla.
Elena, thank you so much for that very nice introduction. I guess we'll launch into the presentation. I'd like to first make sure that you can all see my slides. Full screen? Wonderful. So thanks very much to Accessible Pharmacy, Alexandra and Andy and the Glaucoma Foundation for the opportunity to present to all of you today. I'm really honored to have this opportunity to speak to such an important audience, our patients. So today we'll be talking about lifestyle in glaucoma. We'll first go over the definition of glaucoma, the epidemiology of this condition, management goals in glaucoma, options to fulfill these goals, and finally, we'll talk about some of the lifestyle changes that patients, all of you, ask us about in clinic. These include the use of vitamins, exercise, meditation, and yoga, whether quitting smoking will help with glaucoma, and whether the use of marijuana may enhance the treatment. Of course, this list of questions is really so much longer than what I have here, and I'm eager to learn more about what this audience wants to talk about, perhaps in future follow-up conversations. So this slide shows a picture of a glaucomatous optic nerve as well as a normal optic nerve. And I want to tell you that glaucoma is often undiagnosed. About half of those people who have glaucoma actually don't know that they have it. And 1 in 40 adults older than 40 years of age have glaucoma with vision loss. Glaucoma tends to not be symptomatic until late in its course of disease, although some people have central visual field defects that can be symptomatic early on. And sometimes patients describe symptoms such as hazy vision or looking through a fog or a lot of glare being present that can be associated with glaucoma. Vision from glaucoma at this point cannot be recovered, although there are a number of promising studies that show that probably in about 10 years' time, we will be able to provide some neuro enhancement or recovery of the vision loss from glaucoma. The number of people affected by glaucoma will double in the next few years. So right now there are about 64 million people affected by glaucoma. This was a measurement that was taken in 2013. This is projected to increase to 111 million people by 2040. So how is glaucoma defined? Glaucoma is a characteristic optic neuropathy. It's associated with the development of distinctive patterns of visual dysfunction. It's a degenerative disease of the optic nerve that presents to the physician at various stages. On this slide, I have a photograph that shows the spectrum of disease in glaucoma. On the left side is undetectable disease. This is the point in which we see accelerated retinal ganglion cell death, retinal nerve fiber layer changes, and eventually, as we move to the right side of the picture, we go from undetectable disease, which we can't find even on our best of instruments, to asymptomatic disease, which we know exists but is not yet affecting the person's life, and finally to functional impairment, in which there are visual field changes that really are affecting the person's quality of life and functions. Here I have a picture of a glaucomatous optic nerve as well as the macula, this part of your retina that's responsible for your central vision. So what is your doctor looking at when they look into your eye? So glaucomatous optic neuropathy is defined by many of the features that we see here. These include vertical elongation of the cup, which is the very central part of the optic nerve. In this picture, this part looks a little bit whiter than the rest of the optic nerve. It's also defined by thinning or notching of the neuroretinal rim. This is the orange part of the optic nerve that we can see here that's in the outer periphery of that white area. Retinal nerve fiber layer loss. So this is projections of the optic nerve onto the retina, and this is lost in glaucoma. We also see progressive change in glaucoma, and we like to measure any functional change in glaucoma on visual field testing. Many of you who have had glaucoma or are being screened for glaucoma have undergone visual field testing, and we know that it's no one's favorite test, but it is very helpful to us. Glaucomatous visual field defects appear the way that they do in this photograph, which you can see. My slide shows a defect that respects the horizontal midline. So the defect in this picture is all down below. This is an inferior visual field defect. And you can see that it starts out near the nasal part of the person's visual field and then extends to the periphery and is maybe affecting the way that this person is reading, even walking down steps. There may be areas where this is not very clear for this patient. So having this visual field provides the physician with some understanding of where the patient is having functional defects. And very importantly, it allows us to track these defects over time as patients typically undergo serial visual fields. Here I have a picture of a visual field that starts out as normal and over time develops visual field loss. And in this series of 4 pictures, we can see that eventually this person has developed severe damage from glaucoma, and there's only one point in the center that this person is able to see out of within this eye. Because of glaucoma's progressive nature, glaucoma treatment really aims to slow down the rate of visual function loss over the participant's lifetime. An intraocular pressure reduction is the only known modifiable risk factor to slow the progression of glaucoma. Essentially, we don't want any sort of progression to occur, and especially not progression to the point of having a significant effect on the person's quality of life. The mainstays of glaucoma management include eye drops, laser that's done in the office, or surgery that's done in the operating room. And the common goal of these treatments or these management options is to lower the intraocular pressure, or IOP, and mitigate disease progression. However, this doesn't work for everyone because some patients may not tolerate the medications well. Some may not get the expected treatment from their laser, and some may be poor surgical candidates. So really, for a variety of reasons, not a day goes by in clinic that patients don't ask me, what more can I do for my glaucoma? I'm using my prescribed medications appropriately. I underwent the laser or surgery you asked me to do, but I'm now wondering what sort of lifestyle changes can be done. Can I undertake to change the course of my disease? And so let's talk about some of those today because our audience may be curious about this as well. So this slide shows a popular meme in which there's a baby saying, what more can I do for my glaucoma? Are vitamins the answer? So vitamins for eyes are not a new concept. As many of you know, there's a formulation of vitamins that have demonstrated some benefit in preventing macular degeneration. However, there's no vitamin product that has shown a clinically impactful benefit in glaucoma. Our group from Columbia University sought to test whether a combination of nicotinamide and pyruvate, which are both over-the-counter vitamin supplements, would have a positive effect on visual fields in patients who have glaucoma. On this slide, I have a picture of an article that was published in 2022 on a short-term clinical trial studying these 2 over-the-counter vitamins. So what is the potential mechanism of nicotinamide and pyruvate in glaucoma? We know that glaucoma affects the mitochondria of retinal ganglion cells. These are cells that live in the retina and extend back through the optic nerve and connect to the brain. And we know that glaucoma negatively impacts the cellular metabolism and energy supply of these cells. In a mouse model of glaucoma, oral administration of these vitamins, nicotinamide and pyruvate, prevented glaucoma in 93% of eyes. And on this slide, I have heat maps of gene expression changes for nicotinamide. And we can see that the eyes that received nicotinamide were remarkably similar to the control group. And this same finding was seen in the mitochondria of the patient, of the mouse eyes. And we can see that the mitochondria of the eyes that received nicotinamide was also very similar to the control eyes, as opposed to the mitochondria of those eyes that had glaucoma and did not receive nicotinamide. So our study that was previously published was a placebo-controlled, double-masked, randomized clinical trial. So this means that patients and their physicians did not know whether they were receiving the vitamins or an inactive rice flour pill, or placebo. We assessed many patients for their eligibility in the study and ended up randomizing 42 of them either to the vitamin group or to the placebo group. Ultimately, there was a 2-to-1 allocation with double the number of people in the vitamin group as compared to the placebo group. And in this table, we can see that most folks had early to moderate glaucoma based on their visual fields. This table just has some baseline demographics with the average age, the average visual field score, etc., and essentially tells us that most folks had early to moderate glaucoma. In this slide, we have our study's main findings. So the primary outcome of the study was improvement in visual function based on visual fields. And in this study, we found that oral administration of 3 grams a day of nicotinamide or vitamin B3 and 3 grams a day of pyruvate for 2 months led to the improvement of a median of 8 additional visual field test points as compared to placebo. So patients who had taken these 2 vitamins for 2 months were able to see a few more points on their visual field tests. This is pretty promising, as this has not been shown in prior trials such as this. So what are the next steps for the study? So these findings that we saw in this short-term 2-month study are now being looked at in a larger study with long-term follow-up. And we're aiming to determine whether the effect of nicotinamide and pyruvate, these 2 over-the-counter vitamins, in addition to standard of care pressure-lowering therapy, has a positive effect on glaucoma progression as compared to placebo. And this is the question that we're asking, is whether these vitamins can slow functional and structural progression over a longer term duration. We're going to be looking at function with visual field testing, which we went over a little bit earlier, and probably many of you are familiar with. We're going to be looking at optic nerve structure with OCT testing, which gives us an analysis of the very important parts of the optic nerve, the ones that are specifically relevant in glaucoma, the measures that are specifically relevant in glaucoma. We'll also look at the safety and tolerability of these 2 vitamins and look at the potential effect that they may have on the quality of life of patients. So essentially, we're going to screen these patients. We're going to perform a baseline visit to confirm that they are in fact eligible for the study. Then half the group will be randomized to receiving the vitamins. The other half will be randomized to receiving the placebo. And everyone's going to be followed for 87 weeks with these visual fields, the OCTs, the quality of life questionnaires, and so forth. And our eventual goal is to identify therapies for glaucoma that slow or reverse optic nerve damage by targeting possible etiologies of the condition rather than just lowering the eye pressure, which is what's currently done. So let's get into some other options, other lifestyle changes that one could possibly make. How about exercise? So there is some evidence to show that aerobic exercise may decrease the risk of vision loss from glaucoma, and that glaucoma patients with severe vision loss are actually less likely to be active. Participants in this study by Pradeep Ramalu from Wilmer, Johns Hopkins, they found that participants who wore accelerometers for 1 week to measure daily activity and longitudinal visual field measurements were analyzed, and they found that those who had more steps per day, more moderate to vigorous activity per day, and more non-sedentary activity per day had slower visual field loss. So the more that you were moving around, the less likely it was that your visual fields would progress. And they specifically said that the rate of visual field loss was decreased by 10% in those who had an additional 5,000 steps daily or 2.5 hours of non-sedentary physical activity. This is encouraging because physical activity we know is good not only for the eyes, but also for the rest of the body and for overall health. But this is promising that physical activity may be a way to improve the ocular health as well. What about meditation? Could that help? So we know that meditation involves focusing or clearing your mind using a combination of mental and physical techniques, deep breathing, and concentration. Meditation also has found to have beneficial effects for overall well-being. It's non-invasive, it's low risk. Does it do anything in glaucoma? So in this study, 60 patients with open-angle glaucoma who were taking maximal topical medications. They were on all the eye drops they could be on, and they were scheduled for trabeculectomy surgery, were included in the study about meditation. So 30 patients, half the patients, underwent 3 weeks of 45 minutes of daily meditation sessions in addition to all the medical therapy, while the other group continued only the medical therapy. And the type of meditation that they had was they had focused breathing and being attentive to the present moment. This was an activity that was done as a group. This group found that in addition to topical therapy, 45 minutes of this daily mindful meditation was associated with a 5-point decrease in the intraocular pressure. So just by meditation, they were able to bring their pressure down by 5 points. This is about the same as an additional eye drop is able to bring their pressure down. So that was really pretty impressive. They also looked at some pro-inflammatory and anti-inflammatory genes, and that they found that the meditation was associated with the downregulation of pro-inflammatory genes and the upregulation of neuroprotective genes. So essentially, the meditation may have been bringing down an inflammatory state in the body. Overall, we know that mindful meditation is a low risk, low cost activity, may help reduce intraocular pressure, and it may also be beneficial to one's overall health. How about yoga? Would that help? Yoga kind of takes things one step further, and in addition to the concentration and deep breathing, one practices physical poses. Are these beneficial in glaucoma? Yoga is generally considered safe, except for positions in which the head is below the heart for any sustained period of time. So in this study of 75 patients, the pressure was checked before, during, and after a headstand. So all the subjects in this study were actually normals. They were not glaucoma patients. And all subjects except for one maintained a headstand for 5 minutes. They found that there was an average increase in the intraocular pressure by 15 points immediately following the headstand and remained elevated for 5 minutes. And pressure actually doubled during the headstands. The maximum pressure that they saw was doubling to 44. So in poses where the head is below the heart in yoga for a sustained period of time, we do not recommend doing those if you're a patient with glaucoma. How about stopping smoking? Does that help? So this study of 12 million people found that smokers had a higher level of intraocular pressure compared to non-smokers, and they adjusted for a number of different things. So they took into account age, gender, glaucoma, other ophthalmic diseases such as age-related macular degeneration, surgery, etc. So smokers tend to have higher pressures than non-smokers. This study found that smoking more led to greater thinning of the retinal nerve fiber layer, that very important part of the optic nerve that we were speaking about earlier. And these are the nerve tissues that carry signals to the optic nerve. So we know that there are many factors that affect deterioration in glaucoma, but smoking is one that's really modifiable. So we absolutely recommend that you stop smoking for your glaucoma and also for your overall health. Smokers have an increased risk of developing all types of glaucoma. Heavy smoking leads to higher risk of developing glaucoma, and even cutting down how much you smoke really could help. How about marijuana? Patients ask us about this all the time. Does this provide a therapeutic benefit in glaucoma? So we know that marijuana is made of the plant Cannabis sativa, which has 2 potent compounds, THC and CBD. THC is what's responsible for those psychotropic effects that we always hear about with marijuana. It actually might lower the pressure in some people. CBD actually can increase the pressure in some people. The mechanism of pressure lowering with either of these compounds, especially with THC, is not well understood, but we think that maybe these cannabinoid receptors are in the ciliary body, trabecular meshwork, Schlemm's canal, all these parts of the eye that are important in glaucoma pathogenesis, and they may affect aqueous production and outflow. So what kind of people are interested in marijuana for glaucoma? There was a study that was performed on this, and they found that intentions of using marijuana for glaucoma was significantly associated with perceptions of its legality and acceptability, false beliefs about marijuana use for glaucoma treatment, and satisfaction with the current glaucoma management, as well as costs of treatment. Perceptions about marijuana safety, systemic adverse effects of marijuana were not really found to be significant. So people aren't really thinking as much about what marijuana could do to the rest of your body and what smoking can do to the rest of your body when they're making these decisions. In 2010, the American Glaucoma Society, which is the largest society of fellowship-trained glaucoma specialists in the United States, made this statement about marijuana and its use in the treatment of glaucoma. So let's break this down a little bit. So first of all, can marijuana lower the eye pressure? In 1971, they did a study. A study was done that showed that marijuana smoking in normal volunteers was found to lower the intraocular pressure by 30%. About a decade later, there was a better design study, a placebo-controlled trial of THC, the part of marijuana that has psychotropic effects, and they found that the pressure was reduced from 28 down to an average of 22 with this drug. Then they tried eye drops of THC, and in this study, they did not find any lowering of eye pressure, but they did find that the eye drops made the eyes very red. Then there was another trial, a crossover trial on THC again, and they had only six patients in the study, and they found that this drug really did not lower the pressure much at all. So let's talk about whether marijuana can raise the eye pressure. So cannabidiol, which acts as the antagonist on the CB1 receptor, may actually increase the eye pressure. In 2006, there was a study that found that cannabidiol actually raised the pressure compared to placebo. In 2018, a study found that when cannabidiol was administered with THC, it negated the pressure-lowering effects of THC. So in conclusion, we really just don't know whether it's going to lower or increase the pressure. And let's talk about its side effects. So marijuana is an unregulated botanical. Its potency has increased from the early 1980s to now from about 1% to 33%. The potency of THC, CBD, and the potential for contaminants such as pesticides and other molecules vary by strain. And there are also numerous drug-drug interactions, drug-vehicle interactions, teratogenicity, carcinogenicity, and penetration into breast milk. All these things are just really unknown about this unregulated product. It also has a short duration of action. So its peak effect in lowering the eye pressure is at about an hour to an hour and a half after you've taken it. And it has only a short duration of action, so only 3 to 4 hours. So imagine having to use any eye drop, 6 or 8 times a day. Most of us would probably not choose that treatment. So if you were to use marijuana, you'd have to use it every 3 to 4 hours for it to really have any significant effect on your eye pressure, whether it's an increase in eye pressure or a decrease in eye pressure. And this is also not very cost effective. There haven't been any well-designed studies on the use of marijuana. They all have a small sample size, which means that not many people were participating in them. And there's a lot of pressure fluctuation in the studies that are available, pressure going up or pressure going down. So there just really is a lack of evidence that shows that marijuana alters the course of glaucoma. At this point, it's really impossible to separate the potential clinical action from the undesirable behavioral effects of marijuana. And there are also so many social effects. We know that car accidents doubled after the legalization of marijuana in Colorado. Emergency room visits for injuries, psychiatric and other medical issues are also higher in users versus non-users of marijuana. And even if there was a non-psychotropic version of marijuana that were created, it has very short duration of action. So that would mean that you'd have to use it 6 or 8 times a day in order for it to be effective in lowering the eye pressure. So the American Glaucoma Society does not recommend the use of this drug in any form for the treatment of glaucoma. So overall, in summary, we've talked about many unconventional options as complementary treatments for glaucoma. These are topics that come up on a weekly basis in our clinic. So what are our takeaways here? Our group at Columbia is trying to understand whether vitamin supplements can slow the rate of glaucoma progression, whether other groups have looked at whether aerobic exercise and meditation may be helpful. We know that yoga is probably fine for the glaucoma patient for the most part, as long as it does not involve positions where your head is below your heart. And quitting smoking is important for glaucoma and your overall health. We don't think that marijuana will provide any benefit for your glaucoma, and in about 50% of patients, it can actually raise your eye pressure. We recommend continued close care with your ophthalmologist as recommended. If you're taking glaucoma medications, take these on time each day. And if you're taking other systemic medications, do the same for that. And take care of your overall health, which includes your mental health, because all of these treatments and diagnoses can take a toll on us. And please take some time every day to help yourself in that way. Thanks very much for listening to this presentation, and I'd like to thank the Glaucoma Foundation as well as Accessible Pharmacy for your support, and specifically the Glaucoma Foundation for its support of groundbreaking research, including our vitamin trial that I discussed today. Thank you again.
Awesome. Thank you so much. Let me get this together. Thank you, thank you, thank you to both of you. Thank you, Elena and Dr. Shukla, for doing this with us today. Elena and her work with the Glaucoma Foundation. Elena, thank you for speaking and sharing all of that information. Everything the Glaucoma Foundation does is incredible. Please check out their website and all of their upcoming events and their webinars. And Dr. Shukla, thank you so much. Your presentation was wonderful. I learned an incredible amount. I'm sure I'm speaking for everybody when I say that. Thank you for all of the work that you do. And thank you for being here and discussing it with us. You both are absolute rock stars. We're so thankful and excited for having you both in our community. Thank you for everybody for attending. I hope that this was a really helpful experience and webinar. I also want to extend huge gratitude to Melissa for her interpretation over the past hour and for helping us with the accessibility of this webinar. As I mentioned earlier, I will be sending out a follow-up email in the next few days that will have, first, it will have the recorded video and audio of this webinar, as well as the transcript, so that you can go back and have access to the webinar in the future. And then other than that, those recordings will also be available on our website, accessiblepharmacy.com, as well as our YouTube page. Also, when you get the follow-up email, please go ahead and respond to it and let us know your feedback on the accessibility of this webinar, as well as how we can make programs like this more accessible in the future, and any ideas you have for future speakers and future topics. We would love to hear from you. And I would just like to say before we leave, if you are not a patient of ours here at Accessible Pharmacy, we would absolutely love for you to join us. We learn about how to support more patients by listening to our current ones. So we would love for you to join our community and give us your feedback as a patient so that we can learn how to be more accessible and learn about other services that we should be providing. If you are a provider and believe that you have patients that would benefit from our services, please don't hesitate to reach out to us as well. We would love to hear from you too. So the easiest way to work with us is to simply call us at 888-633-7007. All right, thank you for attending today. This was our Blindness and Glaucoma webinar. We were so happy to put it together for you and have you all attend. Thank you, Elena. Thank you, Dr. Shukla, and thank you, Melissa. Please check out our information on our website for the upcoming webinars in September, as well as October, and the Blind Health Expo at the end of the year. Other than that, we will be in touch with the follow-up email, and have a great weekend.
Bye, everybody.